Dayna Johnson here today with the amazing Linda Miles. Linda Miles has been in dentistry for 50 years and practicing consulting for 34 years. So I feel very honored to be with her today. So Linda, when I'm out in dental practices, I get a couple common situations that come across. The dental team will come up to me and will say, Linda, or they say, Dayna, my doctor has no vision. We don't have any leadership here in our practice. So how can I talk to my doctor, or maybe give me some tips that I could maybe bring to him and say, give us some leadership here?
This is a real common issue that I also have team members come up and say, what do you do when you are full of energy and you want to go back and change things and your doctor is the problem? And I believe that you have to have a vision, you have to have strong leadership, and if the doctor refuses to lead the practice, they must hire an office manager who can. But you can delegate authority, but you can't delegate as a leader your responsibility to lead. So one of the good questions you can ask these doctors is, how committed are you to having a successful practice on a scale of 1 to 10? And if they say, well, I'm a busy dentist, I'm into clinical, and I don't really like the management side, I really would say I cannot work with your practice, because until you're a 9 or a 10 on a commitment level, I can't get your team on board. So I think that if you refuse to take them on as a client, you're going to be happier and they're going to realize they've got to step up to the bat.
If they don't bring a consultant in, is there anything that the office manager could maybe say to the doctor and say, look, my team is screaming for some leadership? Is there something that maybe you could let our office managers know? Maybe there's some tips you can give them?
If the practice administrator is getting complaints from the rest of the team that our doctor just doesn't seem excited, he or she comes in late in the morning and we're excited, we want this practice to grow, and the doctor's the problem, then the practice manager can just sit down with the doctor and say, doctor, do I have permission to give you some information that you won't like that will help your practice? Asking the tough questions and the permission, and then just say, because I care about you, I care about your family, I care about our patients and our work family, I can't help you without your help.
Thank you.
And here's what I need from you: communication, excitement. You need to be here the first thing in the morning. I mean, what would happen if the dentist showed up 30 minutes before anybody else and says, I'm ready to go, let's go?
Great. Great, thank you. One other situation that I see out in practices today is the doctor is the micromanager. So he delegates this to-do list to his front office team. It might be things that really don't even pertain to their day-to-day schedule, and they find that they're bogged down with this micromanaging and they don't have time for their calling their patients and filling the schedule. And so what kind of advice could you give our front office team members on how to deal with that kind of a situation?
It's one of the most prevalent and serious issues in dentistry, in my opinion. I personally could not work long with a micromanager. I believe in teaching the doctor the 4 key words of empowerment. The 4 key words that I would have to share with my potential employer or my current employer is hire me, train me, trust me, and occasionally praise me, and you'll see me totally empowered. But if you continuously have to second guess everything that I do, you've given me a title, you've given me 0 authority, 0 trust. Trust breeds loyalty. You'll never have a team member, me or anyone after me, that's loyal to this practice or to you, because there's no trust.
Thank you so much. That is such great information for our viewers.
Thank you, Dayna.
I'm so honored to have you now as a colleague and a friend. Thank you so much.
It's wonderful to be here with you. Thank you.